So some background. So obviously the food choices we make have a very important impact on our health. And it's important to maintain proper nutrition and a normal body weight to achieve a long, healthy life. There are so many health risks associated with a poor diet and with obesity, and I see these all day long in my outpatient primary care practice. And some of those health risks include diabetes, high blood pressure, high cholesterol, heart disease, and some cancers. And we'll chat more about all of those things in the future in this lecture. So we'll get into detail on all of those subjects. And you know, as a lot of us do know, heart disease is the leading cause of death in the United States. On average, someone dies of cardiovascular disease every 40 seconds. On average, someone has a stroke every 40 seconds. On average, someone dies of a stroke every 4 minutes. So those numbers are pretty astounding. And those conditions are certainly prevented with healthy lifestyle, diet, and healthy exercise and good habits. And here's another slide that sort of details the top killers in the United States. Leading the list is heart disease. Number 2 is cancer. So you can see this chart from the AHA from 2015. It's a little out of date, but it's not so far out of date. So next, we're going to define obesity. So I don't know how many of you are familiar with obesity definitions, but we use the body mass index to define obesity. And BMI is defined by your weight in kilograms divided by your height in meters squared. So a BMI of 25 to 29 is the overweight category. A BMI of greater than 30 is obese. And a BMI of greater than 40 is considered severe obesity. So were you guys familiar with some of that terminology before tonight, or is this all new? So it's something you're fairly familiar with? Yep, not totally new? Okay.
Why is it important?
What's that?
Why is body mass index important?
So right, so we use the body mass index to really tell us where you fall and whether or not you fall into the obese category, the overweight category, and you know we'll talk more about that, but that just sort of helps you figure out where you are. And what I recommend for people who really don't know where they fall is to use an online calculator or to just do math kind of the old-fashioned way, right? By converting their weight into kilograms and dividing that by their height in meters squared. But that's something your doctor can help you with, and that's something when you go to every appointment you should really be like assessing. They should really be looking at your BMI and reviewing that with you. So if you don't know what your BMI is, you can ask your doctor and they can go through that and they can tell you where you fall in that spectrum.
So, can you hear me okay? So obesity, having these benchmarks is also important because there's certain diseases, like Florence has mentioned, that are related to obesity. So a lot of times a physician might see your weight versus your height and then be looking at monitoring you for things like your hypertension or high cholesterol. So these can just be more of a benchmark for them to be aware of other complications in the future.
So this places you at risk for those conditions, like we said, heart disease, and we'll talk about more of those. Yep, you got another one?
I have a question about BMI. Isn't that have to do with, as older people, they don't have as much muscle. So
right.
They can really have a high BMI, I think.
Right, so fat and muscle go into that differently. So it's like you're saying, it's not exactly accurate for every population. So super athletic people with a lot of muscle mass might have an inaccurate BMI. It might say that they are in a higher BMI category, when that might not be the most accurate thing for that patient or that person. So I would just talk to your doctor about kind of where you fall. Yeah, go ahead, sorry. Muscle can sort of artificially raise the BMI, yes. So, yeah. All right.
Either way, you were right to say that about body composition. It does change as you get older, so you weren't wrong to say that. That's why these are more just benchmarks, right? So these are guidelines that physicians go by to see if you're at risk for other things and to be used more for monitoring purposes.
Any other questions? Are we good to continue? We're okay? All right. So obesity is common, serious, and costly. So more than 1/3 of US adults are obese, so 36.5%. The estimated annual medical cost of obesity in the US was $147 billion in 2008. So if you think eating healthy is expensive, just wait till you see the medical bills from eating cheap and crappy food. I don't know, it's kind of funny. So obesity affects some groups more than others. So non-Hispanic Blacks, almost 50% fall into the obesity category. Hispanics, 42.5%. Non-Hispanic whites, 34.5%. Non-Hispanic Asians, 11.7%. Middle-aged adults age 40 to 59 years old, 40.2%. Age 60 and over, 37.0%. Age 20 to 39, 32.3%. So in some of these groups, nearly half of the population falls into that obesity category. That's incredible. So it's astonishing, really. So let's take a look at CDC data on obesity prevalence in the United States. So not to bore you with numbers, but this map is super concerning for us, right? So this is 2011. And looking at this map, the green areas indicate an obesity prevalence of 20 to 25%. So the green states are still, they're not doing great. They're still in a 20 to 25% obesity prevalence range. The orange, and then you'll see the red kind of appear in later slides, indicate a 30 to 35% for orange, and then a greater than 35% for red. And in future slides, you'll see the red states appear. So this map is mostly yellow and orange in 2011, meaning that the prevalence of obesity in 2011 was greater than 25% in most states. So we'll take a look at 2012 now. In 2012, things change around, but not too much, but most of the map is still yellow and orange, meaning that the obesity prevalence was greater than 25% in most states in 2012. As we look at 2013, you'll see some colors changing around. Some red states make an appearance, so that indicates an obesity prevalence of greater than 35%. So in 2013, our neighbor, West Virginia, turned red. So the map is looking a lot worse at this point. There's still a couple green states. 2014, half of that map is orange at this point. We have added a couple of red states there, so again, the red is greater than 35% obesity. And in 2015, the map is pretty much half orange at that point. And our last data comes from 2016, when more than half of the map is orange, and we can break this down on the next slide and look at this in more detail. So in 2016, no state had a prevalence of obesity less than 20%. 3 states and the District of Columbia had a prevalence between 20 and 25%. 22 states had a prevalence of 25 and 30%. 20 states, Puerto Rico and the Virgin Islands, had a prevalence of between 30 and 35%. And 5 states, Alabama, Arkansas, Louisiana, Mississippi, and West Virginia, had a prevalence of greater than 35%. So that's super concerning, and obesity is on the rise, and this data comes out every year, and things are just looking a lot worse for us as a nation. So before we talk about the U.S. dietary guidelines and the U.S. recommendations on diet and what we determine is a healthy sort of diet as a country, I just wanted to take a look at what the rest of the world is doing. So around the world, the healthiest diets are high in fruits, vegetables, high in fiber, high in unsaturated fatty acids. So those are the healthiest diets. The unhealthiest diets, and sadly it's pretty much the American diet, is high in processed meats, high in refined sugar, starch, and very oversized portions. So I'm sure a lot of us have heard of the Mediterranean diet and the beneficial properties of the Mediterranean diet. And the Mediterranean diet is very healthy. They eat a lot of produce. The diet is fresh. It includes minimally processed foods, fruits, vegetables, whole grains, fish, poultry. They drink red wine, which is great. They have some olive oil in their diet. They eat nuts, seeds, beans. And their meals are more social events. They're not like the rushed American meal where we try to drive through as fast as we can and eat as quickly as we can and continue on with our day. Their meals are more slow, they're social. People enjoy their meals. So this chart just kind of goes over all of that. And we can see they do eat some meat, but it's very rare, and it's rare that they eat the meat, and it's probably more on a monthly basis. So next we'll take a look at the Japanese Okinawan diet. And again, that's a very healthy diet, and the Japanese enjoy some of the greatest longevity worldwide. A lot of that population lives into their 80s, 90s, and their 100s. So that's incredible. And their diet is rich in fruits, vegetables, grains, soy. They eat fish just about once a week, once or twice a week from what I read. And a major staple of their diet is the sweet potato. So you can see that diagram sort of just goes over that information in detail. Whoops. And the French diet is really interesting because the French are known for their kind of heavier meals, their meats, their cheeses, their richer foods. But the thing that the French and the Europeans do that we really don't do is they really watch their portion sizes. So they kind of eat more of what they want, but it's in a relatively smaller portion. So if you look at how things compare, a cheeseburger in France is about 2.4 times greater in size than our cheeseburger. So that really stood out to me as something kind of like a crazy fact. So, what was that?
So I mean the opposite. You said theirs was larger.
Oh, okay. So sorry. So the French, yeah. Our hamburger is 2.4 times larger than the French hamburger. So sorry about that. And same thing for all of the beverages and all of their servings of just anything. So I misspoke. Sorry about that. But the burger here is 2.4 times larger than the French burger. So we're all good. Okay. Sorry. And looking at the West African diet, so the West African diet is also very healthy, very plant-based, and they eat a lot of plants that are sort of inherent to their land. So a lot of different vegetables, fruits, whole grains, starches, and different beans, nuts and seeds, certain fish. So again, a very healthy plant-based diet. The Indian diet is also very healthy. Their diet is rich in fresh produce, grains, certain spices, including turmeric, which is very healthy. It's the main ingredient in curry, and it has several beneficial health properties, including that it reduces inflammation in the body. It's been shown to really delay dementia and cognitive decline, so it's been beneficial for memory. It's also been shown to improve digestion and improve joint health, so it has a lot of different beneficial properties to it. So as we look at kind of those past few diets we just talked about, we can see that the rest of the world is really eating more grains than we are, more produce than we are, and we are eating way more sugar and fat and meat than the rest of the world is. So that's kind of where we're going wrong when we look at our diet, the American diet, compared to, healthy diets around the world. So health consequences of obesity. So people who have obesity compared to those who have a normal weight are at risk for many serious diseases and conditions, including the following. So all causes of death, high blood pressure, elevated cholesterol, and an elevation in the bad cholesterol, the LDL, and a reduction in the good cholesterol, the HDL. Also, it puts you at risk for type 2 diabetes, heart disease, as we already talked about, stroke, as we already talked about, gallbladder disease, arthritis, sleep apnea, and different breathing problems. Sometimes asthma can be worsened by obesity. Certain cancers have been linked to obesity. Breast cancer, colon cancer, kidney cancer, gallbladder, liver cancer. There's all been connections to obesity. And generally low quality of life, feeling crummy, increase in anxiety and depression, and really just overall body pain and difficulty with physical functioning. So you just can't do things as easily as you could if you had a normal BMI, as we chatted about. And again, just to look at another set of risk factors, so metabolic syndrome is a group of risk factors that raises the risk of heart disease, diabetes, and stroke. And in order to meet the criteria for this condition, which is metabolic syndrome, you have to have 3 of the 5 following risk factors. So abdominal obesity, which is defined as a waist circumference of greater than 40 inches in men and 35 inches in women. A triglyceride level of 150 or greater, an HDL, and that's the good cholesterol, of less than 40 in men and less than 50 in women. Systolic blood pressure of greater, and that's the top number, of greater than 130, and the bottom number of greater than 85. So the blood pressure reading really is important for this metabolic syndrome, as well as the fasting glucose of 100 or greater. So 3 out of 5 of those points there get you a diagnosis of metabolic syndrome, which puts you at higher risk for heart disease, diabetes, and stroke. So in order to prevent obesity, it's really important to balance the number of calories your body takes in with the number of calories your body uses, or the number of calories you burn off. So a calorie is a unit of energy supplied by food and beverages. So everything counts, including what you're drinking and alcohol. A lot of my patients forget that those things do count. Carbohydrates, fats, sugars, and proteins all contain calories. If your body doesn't use those calories, they're stored as fat. So the total number of calories you need each day varies depending on who you are, what your activity level is, whether you're a man or a woman, and your height and your weight. It takes about 3,500 calories to lose 1 pound of body fat. And you can do this by reducing the calories you take in and increasing the calories you burn. So an adult can lose 1 to 2 pounds per week by avoiding or burning about 500 to 1,000 calories per day. So again, this is just calories in, calories out. It's all important. So in order to maintain your weight, if your goal is to maintain your weight, you really want to eat the same number of calories that your body is using. And if you do this, your weight will remain stable. If your goal is, or you're not trying to gain weight, that's caloric excess. In that case, you're eating more than your body is using. So you're putting in more calories than your body is using up. So in that case, you will store those extra calories as fat and you will gain weight. If you're losing weight or would like to lose weight, you need to achieve a caloric deficit. And that generalized concept, okay. And also, while we're talking about all of this, we have to say it's important to stay active, to do something active most days of the week if you can, but at least 150 minutes per week or 22 minutes per day of intense aerobic activity. And that's like a brisk walk. It's also important to do a little bit of muscle strengthening, and the recommendation is 2 times per week, working all muscle groups. And if children and teenagers, they should really be doing something active every day of the week for 60 minutes. So now we're kind of get into talking about specifically what should we eat. So we should all be eating a well-balanced, varied diet. We really should avoid fad dieting. Fad diets, they just limit the nutrition you're taking in, and they don't really work. They might work for the short term, but ultimately they don't work in the long term. And people tend to put back on the weight they lose with these fad diets, and it can lead to your weight fluctuating and kind of the yo-yoing. So it's not a good strategy. So there are so many, and we hear about them every day. People coming in with they've tried this or that diet. We've heard about them all, so we're familiar and can answer some questions about that later. So just to talk about some key recommendations, and Amanda's going to talk about this more, but we should all be eating a variety of vegetables, all of them, all different kinds, even the starchy ones, which some diets say are bad, but really we should be eating all different types of vegetable. There's no bad vegetable. Fruits, whole fruits especially. Grains, at least half of them should be whole grains. Fat-free or low-fat dairy, including milk, yogurt, cheese, and soy, if you can have soy beverages too. We should also be eating protein. Lean sources of protein are better. So lean things like chicken, certain fish, and nuts, seeds, and some oils in moderation. We should be avoiding saturated fats, trans fats, added sugars, and sodium. So we should aim to consume less than 10% of calories per day from added sugars. We should aim to consume less than 10% from saturated fats, and we should all try to achieve a diet that has less than 2,300 milligrams per day of sodium. And if alcohol is consumed, it should be done in moderation. So that means for women, 1 drink per day, and for men, up to 2 drinks per day. And make sure people are of legal drinking age. That's what this says. Sorry, go ahead. Question?
Give the definition of what a whole grain is.
I'm going to let Amanda do that.
Yeah, so we'll get a little more into
She's
it
going to talk about all that, yeah.
when we go over exact food groups. But whole grains are going to be those that are your less processed, more fiber filled, so they haven't gone through the same processing. But we'll go way more into detail, and if I don't answer, you can let me know and we can talk more about it.
Yep, it's coming, so, all right. So the USDA recommends serving sizes per calorie sort of content. So if you try to determine where your calorie range is, you can look up, and on this chart you have in the slides, determine what servings you need for each food group. But just looking at the 2,000 calorie a day diet, you can see that the recommendation is about 6 ounces of grains, and again, half should be whole grains, 2.5 cups of vegetables, 2 cups of fruits, 3 cups of milk that should be low fat or lower in fat dairy, and 5.5 ounces of meat or beans. And that's based off of a 2,000 calorie a day diet. So you can look in the handout and see if your target calorie range is less than that, you can see on these slides where your target should be. Okay. So don't forget, you are what you eat. I need to eat a skinny person as we transition into Amanda's part here.
All right, so my name's Amanda. I know we were introduced. So what I'm going to be going over is going to be a lot of what are your macronutrients, and then also how these macronutrients can be redistributed and what to be watching for different chronic diseases. So say you're watching your cholesterol or you're watching your blood pressure. I'll go over exactly what you should be watching, how much you should have, and what you should be focusing on or limiting in your diet. So just to get started, right here we have what's called the macronutrients. So there's 3 things that make up our diet and provide us energy. So we have carbohydrates, proteins, and fats. So we're going to go into each one of those groups, and I'll explain to you what it is within those groups that you should highlight. So carbohydrates. Why does our body need a carb? Does anybody know? Anybody? Kind of up there, but it's fuel. So it's energy. All of your macronutrients provide energy, but carbohydrates are your main source of fuel, and it's the preferred source for your brain. So brain power, you need carbs. What are your carbs? So carbohydrates are going to be any food that has starches, sugars, or fibers. So when I say that, I mean sugars. People go straight away to thinking added sugar. Cane syrup, or the cane syrups, the high fructose corn syrup, sugar in general, all those ingredients that you know to avoid, but it's also found naturally in foods, like your milk products and your fruit. So what you want to be doing is avoiding those ones with the added sugar. And I'll show you later how to find out what a product has added sugar versus a product that might have natural sugar. And then so starches. Starches, as listed here, it's all those foods, but they're your complex sugars. So complex sugars meaning it's a bunch of branched sugars, and when it's digested in your body, it's broken down into that sugar. That's different than your fibers, because fiber is actually not broken down the same way in your body. So fiber can go through your body undigested. So for that reason, it's seen to be beneficial for your bowel movements. So soluble fiber and insoluble fiber are your two types. Your soluble fiber are going to be those ones that cause like a gummy texture. So think of, as it says on here, your oats. So if you had some oatmeal, it would come like a viscous texture. So imagine that with your bowels. It's going through undigested, so it's helping to keep you regular, thus helping with diarrhea management. Insoluble is going to be your roughage. So think like your raw fruits, your raw vegetables, those listed here. That's also helpful for constipation management. So if you're having trouble with one of those issues, having more fiber in your diet could be helpful. But always stay hydrated. That's a big thing with fiber. Make sense? Anybody questions? So carbohydrates, what there is to remember, so you have those three groups that I mentioned, the fibers, the starches, and sugars. What you want to be doing is reducing your added sugars. So those are the things like you see sugar, the cane syrups, you see the high fructose corn syrups on your products. Those are the ones you want to be limiting. But don't think you have to stay away from fruits or you have to stay away from your dried fruits. It's all going to be just portion size, which Flory did a great job of identifying how much you should be having, which is always based on your calories. So what you also want to be focusing on are those whole grains. So I know we had the question out there. So whole grains are going to be different than your refined grains. So I'll show you on a food label how it is that you can identify a whole grain, but what you want to be thinking is more fiber. So a whole grain is going to have the fiber that a refined grain might not be having. And you should aim to be getting half of your grains from whole grains. So things like your brown rice rather than your white rice, or your whole wheat pasta rather than your regular pasta, or trying quinoa or barley. All of those can be great sources of your whole grains. And finally, highlight your fruits and vegetables, beans, peas, and low-fat dairy. So carbohydrates, when it comes to weight management, I'm going to touch a little more on fiber. So I know I said that word a lot, but it's beneficial for your weight management, your cholesterol level, overall health. But when you're thinking fiber, be thinking that your body is not digesting it. So the calories are going to be lower. Imagine a cup of peanut butter and a cup of berries. So when I looked up how many calories are in a cup of strawberries, it's 50 calories. When I look up how many calories is in a cup of peanut butter, it's 1,500. A big difference, right? So you get the same volume, but the calorie content is much different because the fiber goes through your body undigested. So having those fruits, those vegetables in your diet can help you maintain a healthy weight, help your cholesterol level, and take you out of that risk for those obesity risk factors. And finally, satiety. So since fiber is going through your body undigested, it takes longer to go through, plus it slows you down because you have to chew the lettuce, you have to chew the cucumbers, the tomatoes, whatever it is you're eating. So you're able to pace yourself more. So highlighting a good amount of those on your plate can help slow you down at the same time. And I was on a low carbohydrate diet for a week and lost 3 inches off my smile. So protein, that's your next macronutrient. So when you're thinking protein, just like Dr. Jaffa said, think lean proteins. So not only should you be getting protein, but be thinking lean proteins, be thinking how am I cooking them, avoiding the frying, going towards your baking, your broiling, your grilling, all of those things are fine. So why do we need protein? Most importantly, it's used for your rebuilding of your body. So it says on here it's good for bodily defenses. Think of your skin. If you're not getting good protein, your skin is not going to be developing as well. That's why some people, as they're getting older and they're not eating very well, sometimes their skin breaks down if they're sitting for too long and they have a lot of other health factors going on, but it's also the protein aspect. So as you're getting older, still continuing to have the lean protein helps to make sure you keep good bodily defenses. And skin is your first bodily defense. It's your largest, one of your largest organs. So I mentioned this, so I'm going to skip over it, but it's about highlighting your lean proteins and watching how you're cooking them. And then protein and weight management, just like fiber, protein helps with satiety. So having protein over with your balanced meal, whether it be you do beans, which have both fiber and it has protein, can help make you feel full and help you watch your portion sizes because you're able to slow down your eating and at the same time have this feeling of satiety. But always remember to watch those calories, right? 1 cup of peanut butter versus 1 cup of strawberries. Yes, you're getting the protein from your peanut butter, but is that worth your whole day's worth of calories almost? Probably not. And doctor, I went a little too much on a high protein diet. And finally, your last macronutrient is going to be your fats. So I'm going to go a little quicker through this, but I want to make sure you understand the difference between your healthy and your unhealthy fats and why you still need fat in your diet. Because a lot of people are on the kick that they should be going low fat or no fat, or they should be doing high protein, or they should do a bunch of fat. It's all about a balance, but you need each one of these macronutrients to create that balance. So when it comes to fats, it can be helpful for blood clotting, immune function, muscle contraction. It's used for energy, but even more important, you need fat because it helps you obtain essential vitamins and nutrients. So there's certain vitamins that are fat soluble. You see here that I listed them, but if you don't have any fat in your diet, which, I mean, it's hard for people, I don't think you could do no fat, but if you had no fat in your diet, you wouldn't be able to digest these essential vitamins. And then on here, you guys all have a copy of it. I know it's a little hard to see, but you'll be able to see that the solid fats versus your oils, your solid fats are going to have more of that saturated. So you want to be avoiding your saturated fats. So those are the ones that lead to higher cholesterol levels or lead to more plaque development versus your unsaturated, things like your olive oils or things like, as listed here, your canola oil or safflower. But you'll see coconut oil and palm kernel oil, they're towards the top. That's because if you sat it out at room temperature, it would most likely hold its shape. If you stick a stick of butter on the table for a couple days, there's a good chance it'll still be a stick of butter. If you put oil, it will stay liquid. That's the difference. You see the saturated fat, if it holds that shape, you know it's probably more unhealthy for your arteries at the same time. So fats and weight control, once again, satiety. So fat takes a little longer to break down in your body. So having some fat with a meal can definitely be beneficial. But fat is very high in calories. So for 1 tablespoon of olive oil, you're getting 120 calories. Versus, again, remember that cup of strawberries was 50 calories. And I said you were the good kind of fat. So avocado, good fat. Now we'll go on to micronutrients. So listed here are just some that I'm going to highlight because I think they're a little more of the hot topic. Micronutrients, so we'll have vitamin D and calcium, antioxidants, and then sodium and potassium. So when you're thinking vitamin D and calcium, they kind of go hand in hand a lot of times. Why is that? Because vitamin D is needed for the proper calcium absorption. So vitamin D helps to take the calcium and distribute it into your bones. So without having both together, they don't work as well. So vitamin D, it's known as the sunshine vitamin. It's kind of why a lot of folks might be deficient in vitamin D. So we're wearing a lot of layers. We're probably not getting as much sunlight because we're inside. It's colder, so we're not going outside as often. Our bodies absorb the vitamin D through the sunshine. So by that fact, we're not getting as much, which is why a lot of you might be vitamin D deficient. But you can also still get it through your foods. Some of them are fortified with vitamin D, like your milk products, mainly milk products. But if you see calcium, a lot of times it's also fortified with the vitamin D. And then you'll also notice it says oily fish. Pay attention to how it says oily, right? Vitamin D is fat soluble. So think fat soluble, vitamin D, fat soluble, vitamin E, vitamin K. Those types of things will go hand in hand a lot of times. And then calcium, so that goes along with the vitamin D. Calcium helps with strong bones. A lot of times as you're getting older, calcium becomes even more important. So 1,000 milligrams is about how much an average American under the age of 50 would want to be getting. And if you're over 50, it then becomes about 1,200. So it's about 3 servings of your low-fat dairy products. But calcium can also be found in these foods that are listed here. And you do see how it says fortified foods. So your soy milks. I know even like kids out there, somebody has like grandkids or they have children that are lactose intolerant. You want to be making sure you're getting a fortified soy product if that's what they're using, because calcium is needed for bone development. If you're not using a fortified product, that child might not be getting the bone development they need. And finally, antioxidants, not finally because there's sodium and potassium, but antioxidant-wise, there's 3 main antioxidants which are listed here, but just be thinking variety of colors. So your antioxidants are going to be things like your beta-carotene, vitamin C, and vitamin E. And this is a hot topic kind of because antioxidants are thought to fight free radicals, right? So they can decrease the amount of damage being done to your cells. But what's even more important is having a variety, right? So if your plate has a lot of different colors, there's a good chance you're going to be getting more of these sources. So sodium and potassium, these ones, as listed here, maintaining fluid balance, regulating your blood pressure, helping with muscle contraction, blood pressure, your heart, muscle contraction kind of go together, right? So sodium-wise, the average American consumes around 3,400 milligrams. So that's why it's such a concern, because the recommended amount is only 2,300, which is about a teaspoon of salt. Not much. So what we want to be doing is looking at our food products, paying attention to the food labels, which I'll show you how to find out, is this a good one, is this a bad one, in regards to sodium. But also think about other seasonings. How can I make my food flavorful without adding salt? Black pepper, anything that has the word powder, a lot of times doesn't have salt. So look at your ingredients on your seasonings. If salt is one of the first 3, it means it's probably a lot of salt. So potassium. Potassium also kind of goes with sodium, so both of them are working to maintain that fluid balance. So you want to be having both of them in your diet. And if you do notice, a lot of times, if a product is no longer having sodium or salt to it, they'll put what's called potassium chloride. It has the same kind of flavoring. So what you want to be doing is still paying attention to it. You wouldn't want to be overdoing it, right? So moderation is key. So if something is a salt substitute and it has a lot of potassium chloride, especially if you're having any kidney issues, you definitely want to be aware of that alternative. So what to remember? Have the variety. Think fruits, vegetables, whole grains, beans, peas, nuts, and healthy oils. All right, so now I'm going to have you guys use the little handout I gave you. I wanted to make sure everybody's aware of the new food label that's going to be coming out so that you're not surprised by it, or you don't, or at least you understand the changes. So what we're going to go over is how to be using these food labels. So you'll see on the old version, these are the ones, does everybody see it? The handout, does everybody have one? Does I have extras? Yeah, that's the one that somebody just held up. Yeah, that's it. So be looking at the old versus new version. You'll see on the one that we're using right now is the old version. There's some minor differences, but you'll notice right at the top of the food label is a serving size. That is really important because that food label is going to be based on the serving size. So you see it says 2/3 of a cup, I believe it says, or 55 grams. So just be aware that some foods will have 55 grams, right? But they won't tell you it's 2/3 of a cup. How am I going to know what 55 grams is, right? I mean, I don't carry a food scale in my back pocket. So then you want to be paying attention to how many servings is in that container. So say I had a bag of chips and said it has 8 servings in the container. You have a couple options. You can be really conscious and you can eat only an eighth of the bag, or be portioning it out and be putting it in a bowl so it slows you down and you're paying attention to how much you're eating of it. So after that, you have calories. I think Florence did a great job of talking about what calories mean, but that's energy, right? So if you're getting too many calories, then you're gaining weight. If you're getting too little, then you're losing weight. If you're getting just enough, you're maintaining. So watch your weight at home. If that's something that you're conscious of, I'm not saying every day, but if you step on the scale every once in a while and you notice I'm gaining weight, maybe I'm having too many calories. If you step on the scale and I'm losing weight and I didn't want to, I'm not having enough calories. So fat-wise, what you want to be doing, as we talked about, you want the lower saturated, higher unsaturated. Does that make sense? And so you see the word trans fat, right? So trans fat is in a little bit of your natural products, but it's mainly a man-made fat. And trans fat itself puts you more at risk for the plaque development. So having trans fats cut out of your diet is beneficial as much as possible. So if a product says it has 0, that means it has 0.5 or less. It's deceiving. It can still have some trans fat and they can still put 0. But what I'd recommend is if you see that trans fat has any number other than 0, put it back and pick another one, because there's plenty of foods out there that don't have the trans fats. Cholesterol-wise, so each body might process cholesterol a little different. So if your doctor tells you you have high cholesterol, that's when you want to be really paying attention. And you want to make sure that 200 milligrams a day or less is what you're consuming. Say your cholesterol looks fine, you want to just be watching your animal products. So animal products are those with cholesterol. Just like us, cholesterol's in our blood, the same thing with animals. So you want to be using low-fat dairy, lean meats, maybe substituting in beans rather than a meat one night to help and reduce that cholesterol intake. So sodium, I touched a bit earlier about it. So say you're watching your sodium intake because of blood pressure. What you want to be looking for is if you're having a snack, try and find 150 milligrams or less. If that serving size says 150 or less, that's a good snack. If you're doing a whole meal, right? So say it's, okay, I really want this frozen dinner. It looks really good. Look at the food label. If it's 400 to 500 or less, that means it's not that bad. If it's 600 to 700, that's not going to be a great option for me, especially if you're watching your blood pressure. Food label, they take total sugar, and then they tell you added sugar. So you want to be highlighting more fiber. So the whole grain question, if you find more fiber in your product, you're getting a whole grain. So if it has 1 or less than 1 grams, that means it's probably more refined. If it has 3 or more grams of fiber, that means it's probably a good source of whole grains. And then, so added sugars. You want to be trying to get less than 50 grams a day. So that's why you see on that product where right under total sugar, it has added sugar. It says 10 grams. That's 20% because you want to be getting less than 50 grams a day. And so protein-wise, you want less saturated fat. So if you're finding a good source of protein, you want lower saturated fat in that protein source. So I'm going to do a quick activity with you guys. If you flip over to the back of that page, that same one you're looking at, you'll see 2 different food labels. So both of those food labels are for a similar product. And I want a volunteer, hopefully somebody will volunteer, to tell me which one of those foods they would pick up and decide is a healthier choice at the store. Be thinking calorie-wise, be thinking types of fats, be thinking added sugars, be thinking protein. Which one would be a better choice? Yeah.
The one in the darker.
Okay, good. So what made you come to that decision?
Well, you ended up having no trans fats, or the other one did too, but cholesterol was 10 here and 0 there. But the sodium was still higher. Wait a minute, now why was I thinking? There was a reason why I went behind this. Sugars.
Mm-hmm.
That's
Good.
where I went.
Good. So you picked up on something important, right? So the sugar aspect, just be aware that sugar is found naturally in some foods, right? So you might not see a 0 next to that sugar because there might have been a natural sugar. What else made you think that that one was a, pay attention to your fats, right? So what about the fats?
Even when you broke it down into the diet fiber,
Right.
you had less on that side, and the added, or the sugars period were 10,
Mm-hmm.
and the other one was 18.
Good. How about your types of fat? Did you see that one? Which one has more of the saturated fats?
More saturated fat
Mhm.
would be
The one you didn't choose, right?
yeah.
So I'm going to show you guys the two products. Can anybody guess what those two products are based on the ingredients? What's that? Yogurt, right. So dead giveaway, live active cultures. We're going to go over probiotics a little bit and touch on it. But if you see the word live active cultures, that means you're having a probiotic food. So this is going to be that healthier choice, right? So the one I have here is a non-fat Greek plain yogurt. So it doesn't have much added, it doesn't have any added sugar, but it has the natural milk sugar, right? So it still has sugar. But even more important is you're not getting that unhealthy fats. Versus if I pick this up at the store, the food label, I mean, it looks really good. It looks pretty, it looks all natural. Coconut milk, I heard that's good for me. Coconut oil, as you remember from your fats section, coconut oil, coconut milk has higher saturated fat. So that's something to pay attention to when you're looking at the food labels, right? You want that lower saturated fat. You want to try and find less of the sugars. You want to try and find a good balance of your calories. Protein-wise, if you look at the two proteins, it's also very deceiving, right? So if I'm getting some dairy product, I want to probably get some good protein too. I can see less than 1 gram versus 20 grams, right? So be thinking, what am I getting out of what I'm eating? How is it helping my body? All right, so chronic disease management. If you guys have any questions based on any of the chronic diseases, please let me know. Yeah.
Does whole milk or 2% or 1% have any different sugar?
So the sugar is going to be the same as the fat content, right? So whole milk is 3%, and then you have 2%, and then you have 1%, and you have skim. So as long as you're going lower fat, you're getting less of that saturated fat, so that's a good thing. You don't have to be going skim, especially if you're starting at whole milk, but if you're watching your chronic diseases, so say you're at risk for heart disease, or say you're just trying to live a little healthier, less of the saturated fat is going to help you do that. So lower fat dairy product will help. Or at least portion sizing your full fat, right? So say I do whole milk. Maybe instead of doing whole milk all the time, I only use whole milk in a small amount on my cereal. That's fine. But if you're going to drink an 8-ounce glass 2 times a day, that might be a lot of saturated fat, and you might benefit from using a 2%. Any other questions? Yeah.
Question about the milk. Like
Uh-huh.
there's almond milk and there's different kinds of milk.
Sure.
Do you like really milk? Could you compare them to regular milk?
So for the most part, pay attention to the protein. So a lot of times those almond and soy might not have the same protein content, which, I mean, if you're having a dairy product, why not get a little protein, right? It helps with the satiety. It can make sure you're getting the bone health and the growth you need, but the calcium too. Make sure you're getting a fortified soy or almond milk, and try and stay with unsweetened. You want to avoid the added sugar. So if you're using vanilla almond milk, you're getting added sugars versus using regular milk, you're only getting the natural sugar of the milk. So unsweetened almond or soy is definitely a fine alternative. Mm-hmm. Yeah.
Question about rice.
Uh-huh.
You always say brown. What about jasmine? Does it?
So I just tell people look at the fiber content, right? So some of those wild rices are actually really good, but you won't know until you look at the side. So look at the portion size. If it says half a cup, or 2/3 of a cup, that's usually the portion size of your rice on the food label. And then look at the fiber. If you're getting good fiber from that jasmine rice, 3 grams or more, I think brown rice might even be 2 grams. So if you're getting 2 grams or more with the jasmine, it's still a fine alternative. And then you just want to watch your portion size. About the size of your fist, about a half a cup would be a good portion size. So then you're not getting too much, but you're still enjoying what you like. So chronic disease management, we're going to touch on heart disease and hypertension, diabetes, chronic disease, kidney disease, and irritable bowel syndrome. And then if you guys have any questions about something I didn't cover, you can feel free to ask us afterwards and we can answer any kind of questions. So getting started on heart disease, you want to be adjusting the amount of cholesterol, the types of fats, adding in the fiber, and watching the sodium. So I touched on sodium a lot, so it's always going to be across the board. Try and get the 2,300 milligrams or less, because I want to make sure you guys have lots of time for questions. So cholesterol-wise, just like I mentioned before, 200 milligrams or less. So you want to be watching those foods that might be higher in cholesterol. So egg yolks, if you know you have eggs a lot during the week, egg yolks are the one that hold the cholesterol. So if your doctor tells you your cholesterol is running high, that might mean your body doesn't process cholesterol the same way somebody else does. So maybe egg yolks are something you want to be watching. So at that point, say your doctor says your cholesterol is running high, I would recommend instead of doing an omelet or scrambled eggs with 2 whole eggs, use an egg white with a whole egg. So then you're cutting back on the cholesterol a little bit and see if it helps your levels. So when you're thinking sodium, just be avoiding a lot of the processed foods, be trying to season your foods other ways, spices, herbs, lemon juice, vinegars. And then, so types of fats, be highlighting your unsaturated fat and reducing your saturated fats. And then why fiber? So fiber can, especially that soluble one, the one that's kind of like oatmeal, that gets kind of gummy, that can bind to cholesterol. So instead of cholesterol developing into plaques in your arteries, the fiber in your diet can help bind to it and you can help excrete it. So by having some of that fiber in your diet can also help with your cholesterol levels and obviously heart disease at that point. Hypertension, it's about limiting your sodium. I think people have gotten that one down. But also, I wanted to touch base on what's called the DASH diet. So it's been getting a lot of press lately about being an overall balanced diet. And I mean, the press is right. It's a pretty good diet if somebody can follow it. It's well balanced, it's highlighting things that we've already talked about, limiting your saturated fats, reducing your sodium, highlighting your foods that are going to be higher in potassium, magnesium, calcium, which are your micronutrients, which means you're having a variety of colors. So all of these things are going to be beneficial. If you're trying to work on your blood pressure and you want more information, National Institute of Health has great information on the DASH diet, so that's usually where I'll direct people if you wanted more information on it. But it has been shown in research to lower your blood pressure. So alcohol consumption, we touched on it, but moderate amounts, right? So it's all about moderation. 1 drink for women, 2 drinks for men. So smoking in your heart. So we all know smoking's not great, right? But why is that? Because it can raise your blood pressure, damage the blood vessels, and lower that healthy cholesterol while raising the unhealthy. So that's why you want to be watching your smoking, trying to cut back. It's also related to other things like the lung cancers and COPD. And then caffeine. So caffeine sometimes has mixed messages, right? Should I not be drinking? Should I be drinking? If you're watching your blood pressure, the research on drinking caffeinated beverages and doing it chronically, like say 1 standard cup of coffee and doing it day in, day out, the research isn't the same as doing like an energy drink, right? If you have a very, as it's called, acute intake of caffeine, there's a rise in your blood pressure. If you have a very small amount of caffeine on a more chronic basis, it's not shown to have that same blood pressure effect through all people. So if you are watching your blood pressure and you drink coffee, I would just say to keep monitoring it, right? So if you cut out the caffeine, then you know, okay, well, it helped my blood pressure. But that's not a definite, right? Cutting out caffeine might not help your blood pressure. It's all about moderation. 1 small cup of coffee rather than an energy drink that's going to have a lot of the added sugars and much more caffeine than your normal standard drink. So diabetes-wise, you see there's a balance on the plate. You want to be doing lean proteins, more fiber with your non-starchy vegetables. You want to be highlighting whole grains in moderate portions, so that like half cup, fist size portion, and then not cutting anything out, right? So we know that there's natural sugars in our fruit. That doesn't mean you have to take them out altogether, but you definitely need a portion size. So it's all going to be about your portions and understanding the balance. So having the fiber, having the protein, those slow down digestion. By slowing down digestion, you're slowing down that blood sugar rise. So you want to make sure that you're having these more balanced meals, trying to stick to a schedule. So then you're not skipping all your meals during the day and then having a whole bunch at once. So then your blood sugar shoots right up and might stay up, or it might crash back down depending on what it is you're eating. Right? If you're having a lot of added sugar, or a huge thing of juice or soda, your blood sugar will go up and then probably come right back down. So chronic kidney disease, once again, it's the sodium, the 2,300 milligrams. If you have chronic kidney disease and it progresses to the later stages, just be aware to talk with your physician, because the kidneys are related to filtering out some of the byproducts in your body, right? So if your kidneys aren't working as well, it puts you at risk for having higher potassium or phosphorus levels in your blood. So at that point, say your doctor starts telling you your potassium's looking high, your kidney disease is progressing, these are some of the foods that you might want to be limiting. And what at that point I would recommend, you can ask them if you can see a dietitian, see if it's covered by your insurance, so then you can understand what are my proper portion sizes of these foods, so I'm still getting the nutrients I need without having too much. And same thing with phosphorus as well as potassium. So last one I'm going to touch on is irritable bowel syndrome. So the probiotic piece that I mentioned earlier, supplements versus your natural foods, there's a little bit of a disjoint when it comes to research on the probiotics. So there's a lot of strands. Probiotics are your good bacteria. So your gut has good bacteria, right? So it's not just germs. There's things that are healthy for you to make sure that you're getting good, you're having good bowel movements, you're fighting away the bad bacteria, you're not having diarrhea. But if there's so many strands out there, how can you pinpoint which probiotic is going to be helpful? I mean, it's hard, and that's why the research isn't there for supplementation. But what I do recommend is trying to have those probiotic foods. So you saw on the yogurt that I showed you guys on the food label, it says there's live active cultures. If you see that and you're trying to prevent having some diarrhea, that can be helpful. See if you incorporate it into your diet, see if it helps. If not, then be aware you might be lactose intolerant and be careful. But it can help. Also, with irritable bowel syndrome, what you want to be doing is smaller meals more frequently, trying to keep to a good schedule. You can do food journaling, see what's going on with your body, because everybody's digestive system is a little different. If you notice that you have a lot of constipation all of a sudden that you didn't have before, or you have a lot of diarrhea that you didn't have before, write down what you're eating and see if you're having any symptoms. Maybe I'm having cramping right after my milk products and I didn't even notice. You won't notice until you analyze your diet.
All right, just to go over the last slide.
Do you want that one?
Yeah. And just to wrap up our talk, we're just going to briefly touch on common food-drug interactions. So these are just major ones I think everyone should be aware of. So grapefruit juice can really interact with many medications. So if you like grapefruit juice, I would talk to your doctor and review your med list with your doctor. But specifically, grapefruit juice can interact with cholesterol medications, certain allergy medications like antihistamines, and those are things like Benadryl, certain blood pressure medications, certain thyroid medications, some birth controls, some acid reducers, so things like Protonics and medications like that. And certain, no, but not all cough suppressant medications, so some cough medicines. And I don't know if anyone here takes any blood thinners, but it's always important to remember that certain blood thinners, especially Coumadin, can interact with green leafy vegetables. So your doctor will definitely be talking with you about those things if you are on a blood thinner. And tyramine-containing foods such as chocolate, aged meats, and cheeses, and some beers can interact with certain medications that treat depression. such as MAOIs, so that's a class of medicine called the monoamine oxidase inhibitors. So your doctor should be aware of that, and they should be talking to you about that if you're taking those medications. And also certain Parkinson's medications can interact with those foods. So again, chocolate, aged cheeses and meats, and some beers. And if you're someone who likes natural black licorice, also talk with your doctor, because that can interact with digoxin, which is a heart medication, certain blood pressure medications, and with some of the blood thinners, especially Coumadin. So I would just tell your doctor about your grapefruit juice and your black licorice. We want to know. And then finally, alcohol. So really, just if you're a drinker, even if you drink one drink a day, review your medication list with your doctor and make sure it's safe to take the medicines you're taking, even over-the-counter things, supplements you're picking at the pharmacy. Just review everything with your doctor if you drink alcohol. That's super important. I didn't even list the interaction because there's too many to even list.